Hello, good day. My name is George Obaido. I'll be presenting our work on a voting classifier for mortality prediction post-thoracic surgery. I'm simply a research scholar at the Center for Human Compatible Artificial Intelligence, and I'm also affiliated with the Berkeley Institute for Data Science. Right. For this work, I'll run you through a couple of a couple of sections where we talked about, or we looked at an intro of this study as well as what motivated us to undertaking this research, and also look at the methodology, the methods that we use for this work, as well as the results, some conclusion, as well as what we intend to do in the future. Right now, um, just a brief intro to the concept of thoracic surgery. This is basically a field of medicine that involves simply surgical treatment of organs in the thoracic cavity, and these are mostly used to treat conditions in the heart, the lungs, the trachea, as well as other mediastinal structures. And this procedure, as as classified by the American College of Cardiology and the American Heart Association, they simply term this surgery as mostly or classified as high risk. And this is a very high risk procedure, and adequate care must be taken on patients, especially after surgery is being conducted. Right now, the fact that this is high risk, there has to be, some preventative care that must be administered to patients. And one of the things that motivated us to doing this work is the use of machine learning, which has been applied to many healthcare applications. And previous studies have seen or have shown that machine learning models perform exceedingly well than that's provided by the Society of Thoracic Surgeons state-of-the-art predicted risk mortality, which is the STS PROM, and the Society of Thoracic Surgeon risk models, which is that's provided by the Society of Thoracic Surgeon, which is basically a body that administers benchmarking of what is termed as high risk or simply low risk. And we simply noticed that for some healthcare problem, just using one machine learning algorithm might not be sufficient enough to be able to provide adequate or better diagnosis. So we decided to use an ensemble approach, which is also termed as your voting ensemble. Now, the voting ensemble technique is basically that which is mostly used to improve model performance. So we simply used a number of, or a couple of algorithms together in order to achieve better performance than just using one model or a single model in the ensemble. And one of the things that or the different data sets, or how we were able to train our models on this particular data set. To begin, we simply got this data set from the UCI repository, ML repository, and the data set simply had clinical as well as demographical features. And we noticed that while using the data set, we were able to look at the features of the data set before we decided to use it. We noticed that it had about 470 instances as well as 17 unique features. And these features mostly are the diagnosis after surgery, the amount of hair that are mostly forcibly exhaled, or also the age of the patient. We also check if the patient smoked. Also we also looked at cases of type 2 diabetes. We also looked at a number of features in the data set. So the data set simply had about 17 unique features, and these features were very helpful in terms of our prediction. Now, with the corresponding algorithms that we use, we tried a number of algorithms. We used the logistic regression. We also used support vector machine, random forest, XGBoost, as well as AdaBoost. And we mostly used the voting classifier, which is either a hard voting or a soft voting, to simply train this on a number of these models that we simply employed. And the concept of the voting classifier, like I said, is simply an ensemble technique. And this mostly combines several base classifiers like your logistic regression, support vector machine, and of course, AdaBoost and XGBoost, just to be able to solve a particular problem. So, looking at the description of the voting classifier, we simply noticed that it had, we simply used, the hard and the soft voting, where we, describe the soft voting as that which predicts a class with the largest sum probability from models. And of course, on the right-hand side, you can see the mathematical formalism of the soft voting, and the hard voting is mostly that which is based on the largest sum of votes from from the different models, which is also classified based on the highest majority of votes that are returned for each classifier. So when we combine this together, we're able to derive our hard voting, and of course, for the soft voting, this is based on a number of predicted probabilities for the classifier. And this technique was simply introduced by Dietrich, which was published in the year 2000, and this work was simply based on multiple classifier systems to see if combining a number of algorithms can simply achieve better performance. Now, when we obviously did, we simply got our result from the training of these models. We simply noticed that if you look at the table, you can see that the soft voting had a higher accuracy over all the other base learners, which is a combination of the different learners. And here you can look at the precision. You can see that the precision was also very high. The recall was exceedingly high, and as well as the F1 score. The hard voting also performed quite well, with an accuracy of 95.72, down to the F1 score of 92.62. But it is simply not as not as better as the soft voting classifier that was used. Now, when we looked at this work, we're able to also look further or getting more results, where we looked at the ROC AUC curve just to investigate a particular model output. Here we can see that when we got our ROC or AUC, we're able to notice that the random forest simply had the highest, in terms of the ROC and AUC. And down to the different, just like the plot that, for this table, we simply had a plot. Here you can see that for the soft voting, you find out that each of the bands were much higher, or were much higher than the other learners or the other base learners. And this work simply corroborates with the work of Dritas and Trichka, where they simply used the soft voting as well as other machine learning classifiers for predicting long-term risk associated with high cholesterol. And here you can see that soft voting have simply achieved better performance compared to the hard voting technique. And this is not to say that the hard voting does not perform much better, but of course the concept of the soft voting technique was synonymously better compared to that provided by the hard voting technique. And for this work, we've just tried the voting classifier technique, where we used supervised machine learning for predicting risk of mortality associated with post-thoracic surgery. And here we can see that the soft voting technique perform much better than even single approaches. And that's to say that using a couple of ensemble technique might simply improve model performance compared to just using a single model. And in the future work, one of the things that we intend to do is we would love to try the concept of spatiotemporal technique of mortality risk prediction. That's using a number of time series. Or we could also use something like the LSTM just to for simply time series prediction, just to investigate further based on this data set that we have. Thank you very much. Appreciate any question that you might have. Please kindly send that our way. Thank you.